Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic, Posture, and Movement Clinic. This video has to do with a simple exercise to open up your hip joints. So it has to do with hip mobility, so stay tuned. All right, hip joints, one of the most compromised joints in your body because most of us are sitting behind the desk and it's basically in a flexion. And then you've got the women that cross their feet, their knees, men do too. And basically it's never gets the freedom to move like it should. So what's the best exercise to do to open this up? I love this one. It's a little bit challenging, but challenge in a good way is so healthy. The prereq to doing this exercise is for you to engage your barrel. We're going to make sure that we put the video that shows you how to do that. Because the barrel, this is the pelvic floor and pelvic diaphragm, or the bottom of the barrel. Your abdominal diaphragm is the top. Their front, this area is the front of the barrel, side of the barrel, and back of the barrel. So engage that. This is a movement at the hip. That means you're not going to be doing this. You're going to be hip hinging back with keeping the spine neutral. But watch. You start with the squat. So is this going to show me when I squat? Great. So I'm going to switch over this way. So I'm going to squat, keeping my barrel, keeping my torso upright, so I'm not leaning forward, keeping it upright. My pelvis, this way, my pelvis is not shifted or rotated that way. It's nice and straight. My knee's not out, and from the groin to the knee, I activate from the groin to bring the knee in. I'm not going to just go boom. That's a different muscle. I want to activate the whole inner thigh to bring it in. Why the whole? Because it gives it a much longer arm to keep it in place. Keep that in mind. Longer arm is like a screwdriver. You want to screw something. If it's a short handle, it's not as comfortable and easy and steady as when it's a long handle screw where you're moving it. So keep that in mind. It's all about physics, biomechanics. So I'm going to lower myself like that. I'm going to keep the knee here and start rotating this leg, keeping myself low until I get here. That's as far as I can go. I'm going to lower myself a little bit, keep this here, and see how it's tilted in. I'm going to start bringing it out, not because I'm pushing it out, but I'm activating these muscles. My hand's just feeling it. As it's going, I'm going to start turning this foot down, up, burns like hell. Such a good exercise. You do that a couple times and you're set. It's really, I'm out of breath. It's really a good exercise. It opens the whole joint. It's a almost full circumduction movement of the ball of the thigh bone inside the socket. It's really, really opens you up here. Great exercise. You should make that a routine. If you have any questions, make sure you subscribe to the channel. Ask me your questions. You can contact the office and check out my website. I hope you find these videos helpful. Until next time, take care.